Hello, everyone. Here we are at another episode of the Purposely podcast, and I'd like to introduce you to Alex Newton, who I'm super excited to learn about today. Welcome, Alex.
Thank you, Emily. It's great to be here.
Just realised my microphone was all the way over there, but anyway, we'll be right. So I'd like to kick off by asking everyone the same question. And, well, first of all, are you in Melbourne at the moment?
I am, yeah.
Yep. So you're in Victoria. So it's going to be interesting listening to these podcasts because COVID seems to be a bit of a hot topic. But anyway, let's try and not go down the COVID rabbit hole. But if you were allowed to go to a barbecue or a dinner party right now and you met someone new and they said, "Oh, g'day, Alex, what do you do?" How do you explain what you do? Because looking at your background, it's pretty interesting, and I'd like to hear you sum it up in a couple of sentences.
I think if I met somebody and they said, "What do you do?" I would say that I'm a medtech innovator. At the moment, I'm working with a group of really interesting people trying to develop a medical device. But I still identify as an engineer as well. So in my previous career, I worked as a mechanical and aerospace engineer.
Wow.
And I don't think that side of me has ever kind of gone. It's just that I've added other parts to my career. And so, I still love talking about, engineering projects and things like that. But at the moment, I'm more on the sort of commercial side of a medical device innovation.
Wow, so interesting that you are a mechanical engineer now working in the medical tech space. So what's the story behind the stories, I like to ask? So go right back to the start and talk us through how you arrived at this juncture in your life.
Yeah, for sure. As a kid growing up, my dad worked in the aviation industry for a long time. So I was always drawn to aeroplanes and anything that flew, really. I was really interested in. After school, I applied to study aerospace engineering at RMIT here in Melbourne. I was from Adelaide originally, so I came over to Melbourne at the ripe age of I think I was 18 when I first moved over. And studied aerospace here for a few years and loved it. Met an amazing group of people that I'm still friends with today. Really good friends with a lot of my aerospace friends still. And I think at the time I was really fortunate because when I graduated, there was a small wave of aerospace engineering work that was coming through Australia at the time. So I got picked up by a company here in Melbourne called GKN. Which was a really great company to work for. They had a few really interesting projects to work on, and I actually got opportunities to go overseas to the US to work on some of those projects. So, there I was a couple of years out of uni, and I was working at Lockheed Martin in the US on, some of the coolest aerospace projects in the world. It was an incredible start to my career. I worked in aerospace for about 10 years all up. And then I'm not sure what it was. Perhaps when my now wife, but at that time my girlfriend, got into medicine and started studying medicine. I think that might have kind of kicked off an interest in sort of the technology behind sort of medical devices. And so at some point I kind of thought, I might want to try something different. I studied an MBA at the Melbourne Business School, and one of the subjects that they offered was called Biodesign Innovation, which is a year-long subject. And that kind of brings together MBA students, biomedical engineers and doctors, and you form a team and you spend about 10 months, I think it's about 10 months, actually following people around in the hospital to understand what challenges they face on kind of a day-to-day basis, identifying an unmet need, and then actually coming up with a solution and then coming up with a business that can take that to market. And so we partnered with a neonatologist at the Royal Women's Hospital. Her name's Dr. Christiane Theda. We followed her around. We identified an unmet need in how doctors care for critically ill newborns in the neonatal intensive care unit. And we have been working on that since 2016. Really, it's grown into a startup company, and we're now trying to commercialise our first device. On the scale of idea to having a product in the market, I think that we're probably just over halfway now. So actually, it's a really interesting time to be in the company. But yeah, it's been a really fascinating sort of change to my career. But I think the common sort of thread between those careers is working with really passionate, interesting people on projects that kind of, potentially change the world.
Amazing. That's such a millennial thing to want to do, is change the world, I think.
Yeah.
But so tell us, so you're the CEO of this startup. So What is this device? Like, it sounds absolutely fascinating. I want to know the nitty-gritty.
Yeah, sure. So the problem that we're trying to solve is the challenge of placing what's called a central line into a newborn baby. So when a baby is born very premature, or sometimes when they're born at term but they're sick, they get admitted to the neonatal intensive care unit. One of the most frequent procedures that's performed in that setting is to insert something called a central venous catheter, and it's basically a really thin, flexible tube that doctors insert into the vein of the patient. And the idea is to navigate the tip of the tube until it's just near the heart in what's called a central location. And that's so that the doctors and nurses can deliver quite strong therapies through that tube. And then because it's close to the heart, gets pumped around the body and kind of diffused very quickly. But the challenge that they have is that they don't really know where the tip of that catheter is once it goes inside the body. And so quite a lot of these procedures result in misplaced central lines. So at the moment, the kind of standard of care is doctors will estimate the length based on the birth weight of the baby, and then they'll actually place the catheter and then get an X-ray after the procedure to confirm whether it's in the right or the wrong spot. But around half the procedures, roughly around half, are in the wrong spot. So what we're working on is a medical device called an ECG tip location system. So what we can do is actually measure the ECG signals from the heart, so the electrical signals of the heart, through the catheter. And a little bit like a parking sensor for a car, the closer you get to the wall, the beats get a bit faster. It's a similar sort of principle. By looking at the shape of the ECG waveform, we can actually predict where the tip of the catheter is inside the body. And so having a device like this should make it a lot easier for the doctors and nurses who place these lines, but it can also avoid some really bad complications to the patients who, after all, are critically ill newborns. So look, we're almost at the point where we're commencing the next phase for our clinical research at the Royal Women's Hospital, just up the road here. And it's a really exciting time.
Fascinating. So interesting. Like, how many babies are born prematurely, like, across the world? I know that that's a really random question, and if you don't know, I completely understand.
No,
but
definitely.
Is the amount of premature babies increasing or decreasing based on medicine?
Yeah, that's a good question. I've kind of, because I'm on the commercial side of the company, I've been looking into this sort of stuff for the last few years. There's around 15 million babies born premature every year, and that's actually around 10% of all births are premature to some degree. Now, some of those will maybe only be a week, in which case it's not such a big deal, but some of those are really early. So, the average sort of gestation for a baby is between 38 and 40 weeks. That's roughly what people would call term. But some of the babies that end up in the neonatal intensive care unit are sort of 24, 25 week gestation period. So you can kind of imagine that, these babies that are born still have a lot of developing to do. And instead of developing inside their mother's body, they have to develop inside the hospital. So there's a whole range of sort of challenges that the doctors and nurses need to address there. In terms of is this rate increasing or decreasing? It's actually tending to increase. So different countries around the world have different drivers for this. But in developed countries like Australia, the sort of increasing rates of preterm births are due to a few things. One is we're starting to get more IVF treatments, and IVF treatments often lead to twins, and twins often lead to premature births. The second thing is complications that the mother might have. Things like diabetes can often result in children being delivered a little bit early. So in developing regions, there's a few drivers. In developed regions like Australia, those are the drivers. In developing markets, it's other things. It's like access to care, access to the sort of basic hospital care that we take for granted. If people can't get that basic care, sometimes the babies are born premature. So, there's different reasons for different parts of the world. But overall, the rates seem to be kind of steady or slightly increasing in some parts of the world.
Amazing. Such a fascinating topic. I mean, I'm a mother myself, so I understand how important this is and how critical it is to try and improve birth outcomes for women, no matter where they are. So with the product or the device that you're developing, have you got government funding, or like how are you bootstrapping this startup? Because medical devices and research, these aren't cheap, I imagine.
No, certainly not cheap. When you start on the journey, people kind of tell you, look, this can take between 7 and 10 years to get a product to market in the medical device space, and it can cost up to $10 million. If you tell people I need $10 million to develop a medical device, that's not an unreasonable kind of guess. So in our case, we started off with some funding from the founders of the company. We each put a little bit of money in just to kind of get things started. Certainly, we're not able to put in millions of dollars each. We're not at that point yet. But we raised some money through pitch competitions and sort of business case competitions to start with. It's relatively easy to sort of raise a little bit of money with a good idea. You can kind of put a good idea on a piece of paper and you can win a couple of competitions and get the first few $1,000s. But there's a bit of in the startup world, it's called the valley of death, which is after you've got that first little bit of funding, you actually need to have something concrete, something tangible, or some traction or some results from a clinical study to then raise the next round of funding and the next round of funding. But at the start, you don't have the money to develop the product or do a trial. And so there's this kind of chicken and egg problem. In our case, we were really fortunate. We actually went through a medical device program, an accelerator program in Texas called the Texas Medical Center Accelerator Program, TMCX, which was a really good accelerator program. While we were there, one of our founders actually went to a pitch competition and we won that. And actually we got some funding from the FDA to continue our project. And that was at a pretty crucial point. That kind of gave us the ability to really form a company and bring sort of some more resources to bear on the problem. Since then, we've raised some money from angel investors and from some VC investors as well, some venture capital firms. But most recently, we got a really good Australian federal government grant called the Accelerating Commercialisation grant. So we got $400,000 through that program, which is just like an incredible amount of funding for us. That'll basically help us get to the point where we can have the next phase of our clinical study complete. We can have basically all of the plan sorted out so that we can raise money with confidence to say, okay, this is exactly how much money we need to raise at the next round of funding. This is exactly what we're going to use it for. And at the end of that, we'll have a product that's ready for the market. And so, one of the hardest challenges I think in startups is actually just putting the plan together. There's so many pieces of the puzzle that all have to fit together, and if one thing doesn't fit properly, everything can kind of fall down. And so trying to get everything to fit together and make sense from a technological point of view, from a regulatory point of view, but also from a commercial point of view is really a challenge. And it's one of the benefits, I think, of getting a grant like the AC grant, the Accelerated Commercialisation Grant, is you spend a long time putting this application together, writing out the business plan, validating the technology and telling people what you're going to do. When you get the funding, you don't have to think about the plan anymore. It's already written. It's already been, basically you presented this plan to people and they said, yeah, that looks good. Here's some money, go and do it. And it's great because you can just execute to the plan now. You don't have to kind of keep going out and constantly validating everything. So, that's great. Really helpful.
Exciting stuff. I'm so excited to watch what happens next, because it sounds like you're in a very exciting stage of the business journey.
Yeah, absolutely. Yeah, it is really exciting. Like I said, we've been working on this since. Well, really, we've been trying to understand the problem since 2016, but we started our company in 2017, so it's now actually, we just had a 3-year birthday for the company. So a lot of people would say, gosh, that's a long time. What, you don't have a product in the market yet? There's a lot of people who work on app development or even digital health. They probably can put a product together and start earning revenue in sort of 6 to 12 months. On the medical device space, it's a really long pathway. So to get where we've sort of gotten to within that 3-year period, we've actually done really well. We think it's probably another 2 to 3 years before we'll have a product that we can actually sell. But this journey of kind of developing the product and doing the testing and raising the money, it's really interesting. It's just fascinating. It's actually a really fun process to go through. There's highs and lows, just like anything. But I think the advantage that we've got is that we've got a really strong team, and so that it's a great bunch of people to work with when things are going well, and when things aren't going well, they kind of pat you on the back and dust you off a bit and pick you back up and go, that's all right, we'll get the next grant, or we'll get the next investor, or it's a really supportive team to work in.
Amazing. So how do you personally stay motivated when the actual trajectory of this thing is so long? Like, Millennials have a reputation for wanting things now and being quite impatient. So how do you stay motivated and excited about it?
I don't know why Millennials are thought to be impatient. I think that's crap. But
love it.
The way that I'm motivated, I don't want this to sound like a sort of cliche, but when you're working in the field of kind of neonatal care, look, it's very simple for us to kind of get maybe carried away with writing a grant application, or working on our regulatory paperwork or something like that. You can sit in the office all day and spend 100 hours working on this sort of stuff, no problem at all. But it's when you go back to the hospital and you see the patients and the patients, the parents, the doctors and the nurses, that it's really grounding, and it just sort of brings everything else back into focus. It's like, that's why we're doing all the paperwork, and I think it's really important for us to not forget that. So it's important for us to kind of get back into the hospital when we can. At the moment, for obvious reasons, they're not letting a lot of people into the hospital, so that's okay. But one of our founders, so we've got 6 founders in the company, and one of them is a neonatologist, a doctor, Dr. Christiane Teder. So she doesn't let us forget about why is this important. So I think just having that connection to whoever it is that you're delivering value to, or whoever you're working for, so long as you have that connection, I think that kind of keeps things in focus.
Yeah, and it sounds like it's about ensuring that whatever you're doing, it's purpose-led. And that's what I find with a lot of the interviews that I do, is anyone who's working in an organisation or a business who's kind of fulfilling their purpose or very connected to a purpose, it doesn't feel like work, and it's inspiring, and it means that you can kind of pick yourself up and go on when shit gets hard. So it's refreshing to hear that once again. So I'm going to take you on a bit of a different angle now. So you were introduced to me by a gentleman called Andrew Weatherall, who we've also had on the show, and apparently you two have got a bet happening. So
yeah, that's right.
Tell us about your bet.
So Andy and I have a bet. I think it's whoever gets a net worth of $10 million first has to buy the other one, the most expensive slab of beer in the world. And, I think we made this bet a little while ago. I think I was just starting out in kind of the medtech scene. But another sort of part of my life that I really enjoy is helping Andy out on the Melbourne Space Program. The Melbourne Space Program is a group of predominantly students, but also some industry kind of mentors who kind of aligned themselves towards this amazing project a few years back now, about 2016, to build a satellite and launch it. And, they did it. It's an incredible group of people who just never gave up. Learned a lot. It was one of those projects where at the start nobody even knew what they didn't know. You had to build it and fail a couple of times before you could even sort of understand how to do it the right way. But I think it was about this time last year that I went over to New Zealand to see the rocket launch, and it carried up this satellite, and it was just an incredible feeling to know that a group of hundreds of students have participated in this over the years, but look what they can achieve. And so through that program, through MSP, I met Andy. Andy's one of those people that I think, he's going to be a billionaire one day. It might not be tomorrow, but one day he's going to do very well. So we had a bet. Whoever can make $10 million first has to buy the other one, the most expensive slab of beer in the world. So might cost more than $10 million. I don't know.
Gold-plated beer. I did ask you before we went live, what is the most expensive slab of beer in the world? I mean, you said you don't know, but like, is there beer that's more expensive than other beer? Like, I'm not really a beer buff.
Yeah, but, I think it's just more of a symbolic thing, but it depends. If Andy takes it literally, maybe I'll have to buy him a really expensive slab of beer, or maybe I'll hold his feet to the fire and make him buy one.
Yeah, exactly. Or maybe you have to travel. The cost will be traveling somewhere to buy it.
Great idea. I like it.
Yeah. So thinking outside the square and saying, okay, well, we need to go on a junket. And I mean, where do they make good beer? There's lots of places in Europe.
All over the world. Is good beer.
Germany, that's where I'd be going. My husband's Austrian, so I'm a bit biased. But
there you go. Yep.
There you go. So what are your thoughts? We kind of talked about this before, but what are your thoughts around millennials and the stereotyping of millennials?
Yeah, I don't get it. I just think it's crap. People say, millennials are lazy, or millennials this, millennials that. Like, it's first of all, it's not helpful. But second of all, I just think it's wrong. I'm kind of at one end of the millennial spectrum. I was born in 1982, so I'm kind of towards the start of it. But I work with people in our company. One of the youngest people is kind of early 1990s, and so we're in the same generation, and yet we're very similar in some ways, but we're also very different people in other ways. And I think as soon as you try to fit people inside a box, you're kind of missing out on all of this, diversity, I suppose, I just don't think it's helpful to put labels on people like that. So people say, millennials are lazy, and I think, no, they just work differently than you do. Or they say millennials, they care more about avocado on toast than they do about saving for a home. And I'm like, where are you getting this from? Like, of course, look, of course we want to buy a home. Of course we want to save, and we're not too dissimilar. It's just that the world is changing. Like we don't we don't talk on a fixed line anymore. We've got messaging apps and mobile phones and computers and things like that. We don't write letters anymore. We Zoom and do podcasts over the internet. So yeah, the world's changing. So of course the people are going to change along with it, but I don't think that it's in a bad way.
Yeah, I'm with you there, and I think that stereotyping is definitely unhelpful. It's really interesting though, because when I ask older people their thoughts on a millennial or what's a millennial, their response is very different. When I ask millennials, they're like, oh, I don't even care about titles or stereotypes or any of that stuff. So it's really fascinating. I'm very interested in research and anthropology. It's actually what I wanted to study at university. My dad told me that was a really dumb idea. I should study commerce because there's no jobs for anthropologists. But anyway, I ended up.
What a baby boomer thing to say.
I know.
No, I'm kidding.
Right? And then I was like, okay, well, if I can't do anthropology, I want to study archaeology. And because I was really interested in ancient civilizations, and he was like, there's no jobs for them either. You're being an idiot. And so anyway, he won, and I studied commerce. But then I majored in HR. But I find it really fascinating, even people's differing views around the attachment or meaning of the term millennial. But when you think of a millennial, what are the traits that come to mind when you think of millennials?
I think of people. Well, I mean, this is probably a selection bias, right? But the people that I know within that kind of millennial generation, a lot of them are purpose driven. They care more about working for something that they really feel passionate about. But I'm sure that there's a lot of people out there that aren't motivated like that. But it's just that those are the people that I surround myself with, and so that's who I'm familiar with. I think about people that are good at using technology, but again, I'm sure that there's plenty of people out there that are not. I think, it's just the millennials that I know are not lazy, people who are entitled and just want everything handed to them on a plate. They're the sort of people who work hard, want to change the world, make it a better place, and the same things that other generations want. They want to settle down, have a family, and own a home. It's going to be a bit different. It's not going to be necessarily how other people from a different generation got a home. Maybe I remember when I bought my first home, I was complaining about, I think the interest rate at the time was like 5 or 6%. My mum said, "Shut up," when it was like 15% when I bought a home. So it's going to be different. But I think at the end of the day, we're not. I think our similarities with other sort of generations, there's more similarities than differences, for sure.
Yes, yeah, and I would agree with that. I think that values don't change; it's just the way that those values are expressed. And from my experience, you're exactly right. We all want the same things. We just the way that we express those wants and desires has maybe changed because of social norms about what's acceptable and what's not acceptable. And like if you think about the baby boomer generation, they grew up in a time where, if you wanted a promotion, the person who had the most, the longest length of service was the person who got the promotion. So people were judged based on their loyalty and how long they'd been in a position rather than their capabilities, skills, and whether or not they were the best person for the job. So it's, social norms have also changed, and technology, I think, is probably the biggest, created the biggest chasm between the baby boomer generation and younger generations. And I'm a Gen Xer, so I'm born in both camps. So I remember a time where there was absolutely no technology, and I describe it as I'm a Gen X, so we went from an analog world to a digital world. So I feel like millennials grew up in a digital world, like that was kind of what you guys experienced. But I remember we had one phone at my house, and I used to drag, like, pull it into this kind of cupboard and sit
with
there.
With the springy cord.
Yeah. And I took my son up to my parents a while ago, and they had a phone, and my son was like, "What's that?" Like, he's 7.
How do you play Angry Birds on that?
Yeah, he's like, "What's that?" He's like, "How do you do FaceTime on that?" And it's just like, it's just crazy, like, that he doesn't even know what a phone was. And then, like, he was looking at CDs, and he's like, "What are these?" And I was like, "Oh, that's how you used to listen to music." He's like, "Why?" So it's
it is interesting, isn't it? Hearing you talk about that kind of made me remember a little bit about the start of my engineering career. There were a lot of younger engineers who were really good at using the sort of new technology in engineering. A lot of computer-aided modeling or finite element analysis tools and things like that. But there was a group of old engineers, and we used to affectionately call them the greybeards. Like anyone who was really experienced was a greybeard, even if they didn't have a beard. But those engineers were incredible in what they could do. They could look at a problem, and it was just through their experience they could analyze it and propose a solution that 99 times out of 100 was almost exactly what you needed. And I think kind of learning from that and applying that to today, I think millennials might be better at technology, but that doesn't discount the experience of the older generation. Like, there's still a lot to learn from them, and they still have a lot to contribute. It just is in a different way, I suppose. Like millennials learn quickly and use technology, but there's no substitute for experience sometimes.
I love that. That's a beautiful message in there, and I would 100% agree. And what's really important, I think, over the next, say, 5-10 years is a transference of knowledge and wisdom from the older generation to the younger generations, because I think that transference of knowledge goes both ways, upwards and downwards. And I think that we forget that. And a lot of startups, you look around and it's all young people. But I know that Airbnb, for example, they have a strategy of hiring older workers who used to work in the bricks and mortar hospitality industry or hotel industry, because they don't want to lose that industry knowledge, because it's still relevant, just in a different way. So I think that a lot of companies and young millennial entrepreneurs are very smart in that way, and they understand that there's no substitute for experience. Exactly what you said. I absolutely love that.
Yeah. So, and I think that's the same in a lot of industries, whether it's Airbnb in the hospitality industry or engineering or even in, medical devices. I think wherever you go, that experience is super valuable.
So I'm going to ask you one last question. So what is the best piece of advice that's been given to you throughout your career? Something that you just resonates with you and you've never forgotten?
Well, look, I'm not sure if there's one thing. I think the best piece of advice that I could possibly give someone would be, it's probably around having a growth mindset. So it would be, what the knowledge that you have today is important. But the thing that is going to get you to where you want to go in the future is how quickly you can learn and adapt. And, I was talking to a friend this morning, and I was sort of saying, I've got a friend, and he's not sure if he really wants to go and do sort of something entrepreneurial and innovative and perhaps a startup. But I think he's a little bit tentative about taking that step. And I said to him, that as far as I'm concerned, there's no such thing as failure. If you give it a shot, you can't fail. You might spend a whole bunch of money and a lot of time, and the outcome might not be a commercial success, but you won't go backwards. you will have learned a whole lot. Your next startup will be better. Or if you want to go back to a corporate world, you'll be better at your corporate job because you'll have a whole bunch of new networks. You'll have learned, a whole bunch of new skills because you learn quickly in a startup. And I think that would be my advice is, approach things from a growth mindset. Don't think of things as being a failure. Think of things as being an opportunity to learn and do better. And I think if you can take that approach, it removes a lot of the anxiety around doing startups, and it removes a lot of the, a lot of people are sort of saying, oh, I don't necessarily want to do a startup. What if I fail? Will my friends laugh at me? It's like, no, they won't laugh at you. If you give it a shot and you try hard, of course they won't laugh at you. There's no reason why you shouldn't give it a shot. And I think if you can just take that mindset of, don't worry about the failure or don't think of it as a failure. I think there would be more people doing startups, and I think that would be great.
I love it. That's great advice there. So if people want to learn more about what you do or find you, where can they do that, Alex?
Anywhere. We're on LinkedIn. So our company is called Navi Medical Technologies. We've got a LinkedIn page. We've got a website, navitechnologies.com. You can email us. My email is alex@navitechnologies. I love helping people sort of understand what the startup journey's like. I mentor a few people kind of a bit more formally, but I talk to people all the time about what the startup journey's like and sort of the innovation process to sort of come up with a medical device, make sure that it's what a customer wants before you actually take it to market and things like that. So happy to talk to people for sure.
Beautiful. Thank you so much for sharing your story. Absolutely fascinating, and you're doing amazing work. So I can't wait to see what happens next, and you'll have to keep in contact and let us know how it all goes.
Would love to. Thank you so much, Emily.
No problem. So we will share Alex's handles in this episode, but thanks for listening. And thanks, Alex, for generously giving our community your time and wisdom. It's always really valued.
Thank you very much. Bye.